Hello, my name is Jennifer Bogan, and this is the diabetic foot exam for the diabetes and dyslipidemia class. Um, I have already obtained consent to perform this diabetes foot exam on my patient. My patient is a 25-year-old African American female with a past medical history of polycystic ovarian syndrome. So I have my equipment laid out for my foot exam, and I have my monofilament to test for sensation, protective sensation, tuning fork for vibratory sensation, a cotton tip applicator to test for the recognition of soft and sharp or hard, and also a reflex hammer. Okay, so at this point I have performed hand hygiene and I am now donning my gloves. So the first thing that I want to do when I come in to perform my foot exam is to inspect the feet of my patient. So when I'm inspecting, I'm looking for any visual deformities, such as if there's any hammer toe, if there may be any missing digits or wounds or ulcerations to the foot. I also want to test for temperature on both sides of each foot, noting that if temperature in one foot is warmer than the other, that could be an indication of infection. So I'm also looking at the toenails, knowing that if there's any thickness, increased thickness in some of the toenails, that could be a sign of a foot fungus. I also want to separate each toe, looking to see if there's any broken skin there or any signs of tinea pedis. So my patient does not have any of that. I also want to look for calluses or note if there's any xerosis, dryness of and cracking of the feet, which my patient also does not have. I want to test the circulation, feeling for pedal pulses, and hers are strong. And I also want to test my posterior tibial pulse on each foot, and those are normal as well. Next, I will use my monofilament, and so I would press this against various spots on the foot and bend, and that lets you know how good the protective sensation is, knowing that if there are spots that you cannot feel it, that you would could be a sign of neuropathy in the diabetic patient. So and I would test both feet, and in subsequent exams I would try to test those exact same areas to note any changes. Next, I'll use my tuning fork to test for vibratory sensation. So placing that on the end of the digits in various places on the feet, I would be able to know how well they can sense vibrations. And I would know that if my patient stated that they could not feel the vibrations as long as I could in my hand, that would mean they are at risk for some neuropathy and foot injury. The next thing I want to test is whether they can distinguish between a sharp object and a dull object. So I would do that by striking against this surface of the foot and asking them whether the object was sharp or dull. Another part of the exam that tests for how good the circulation is capillary refill. And since my patient has their toenails painted, I could press on the top of the toe and count how quickly the color returns, which gives me a good indication of how good the circulation is, because in patients with diabetes, we know that they can acquire vascular issues, and that would be an issue because it could lead to neuropathy and also infection, and you may be looking at the possibility of a diabetic ulcer forming. The next thing I want to do is I would want to use my reflex hammer, and I'm going to ask my patient to lift her leg, and I'm going to test those reflexes. And hers are normal, and I would test on the other side as well. So another part of the exam that I would just kind of look at before my patient takes off their shoes when they're coming in the room, I would want to look at the type of shoes they're wearing and possibly ask questions about the normal types of shoes they wear, the support that it offers, as well as the fit, noting whether this shoe is the right length, width, and offers the right amount of support. And I would provide counseling on that if I felt that they may often be wearing shoes that did not give them the right support. And then when we're talking about risk for foot issues for diabetic patients, you always want to inform them about neuropathy, the loss of sensation in their feet due to uncontrolled diabetes. And that becomes the issue because if you can't feel, you may be stepping on something or come across something too hot, such as your bath water, and not be able to recognize that, causing infection and wounds that of course would be difficult to heal due to the uncontrolled diabetes. So some common foot care practices would be to, even when you're just walking around the house, always wear shoes, and good fitting shoes, not ill fitting shoes. You also want to normally keep on white cotton socks to help with moisture absorption. You want to teach them that after bathing, you want to make sure you dry in between each toe completely so as not to cause any excoriation of the skin. And also to do regular foot exams while at home. And depending on the state of their feet at the time of the visit, I could inform them of whether they only needed yearly foot exams or more often, such as quarterly foot exams. If you have a patient that already has had foot ulcers or amputations in the past, you want to talk to them about the importance of not getting another ulceration, wound, or having another potential amputation, because the risk just keeps getting greater for further ones. Also, in addition to teaching, you want to verbal teaching, you would also want to use handouts or videos, maybe even videos that they can find on the internet that are easy to use for continued foot care. Other complications that you would want to teach them about not pertaining to feet would be nephropathy, disease of the kidneys, retinopathy, and various infections that can be caused by diabetes. And this concludes my exam. Thank you.